Right, so Mark, could you go through some of the not the procedures, the tools
Yeah.
that you work
So
with?
when you're going to see an acupuncturist or a TCM practitioner, because acupuncture in itself, Chinese medicine, covers a very vast array of techniques and tools, then you'll very commonly be getting things other than acupuncture, apart from things like massage or dietary or lifestyle counselling. They'll often use moxibustion, this is a moxa stick, which is basically the mugwort herb. And this just gets lit at the end, so it looks like this. It looks a bit ashy, smells pretty awful. Smells very pungent, and then this just gets put over the area, over the point, or it might be waved or glided over the area. Commonly, it feels very nice on the lower abdomen or the lower back. It's very warming. Sometimes we'll also use a heat lamp as well, which is sort of looks like this. This just covers a bit of a larger area, and this one has like an electromagnetic field, so it has some therapeutic property as well. Apart from that, then you get moxa sticks in various other forms. It looks like a big cigarette, but this is a more of a finer grade moxa, which sort of burns a bit more strongly and has less smoke and is a bit more expensive. Then you have the very traditional sort of moxa punk, which is just basically like the coarse moxa herb that's been ground up very fine, and then that just gets compressed into often into things like moxa cones, which is like this. This is a very bad cone, then the top gets lit at the top like that. I'll just light it at the top like that to show you. So, and then it just burns and very slowly burns down.
And how long does that keep on?
It depends on the size of the cone. This is a fairly big cone. So you might have like a cone that is only like the size of a rice grain, or you might have one that's even bigger. You might have one that's even smaller, just depending upon what you want to do. So I'll just put that away.
So most of the herbs and that you do use, where do they come from?
They come from China. Most of the moxa comes from China. Sometimes from Japan. Japan is also very common to produce both herbs and moxa and needles. And then moxibustion can be used for a wide variety of things, often a lot of cold problems or a lot of deficiency problems. So it's very good for building up the energy. Other than that, cupping therapy is very widely employed. And in those cases, you'd be lighting a swab, which is usually soaked in metho, and then the flame just gets put inside the cup, and then the cup gets put on the skin. Okay, and then there's various techniques that they come in various sizes. This is a smaller cup. This is a larger cup. They come in. So you'll do various techniques. Commonly, they can just be put straight on the. So if you're treating a knee, they can be put straight on the knee itself, and this is called retention cupping. You might be moving the cupping around if you're treating a thigh problem. Sometimes they'll put some oil or something on there, and then you can do various other techniques where you sort of take the cup off and put it on. As with needles, you can both tonify or strengthen and sedate or reduce with the cup as well. But the cup is very good for drawing out pathogenic influences like external wind and cold and damp and heat, very good for drawing out heat. And also very good for tight muscles, because what it does is it draws up the blood through the tissues, and then helps helps the tissues to relax. Because the muscle fibers get all knotted and quite tight, so it forces the blood to the surface. And then the mark that's left over, we don't actually call a bruise. Some people will notice like it's like a big round mark that gets left. That doesn't always occur, that you don't always get the cupping mark. And but sometimes they can be just a slight mark, sometimes it can be very, very dark or purplish. And this also has a therapeutic implication. So if it's darker or more purplish, then this represents more blood stagnation or an area of stagnation. Or if someone has it's a very painful area, but it, it might be a bit dark but then go away very quickly, and it's very light, it might be a little bit of deficiency or blood deficiency in the area. So, and it also has other indications, other different colours that you can get, and can have other indications for other different pathogenic substances like cold or dampness. So it's very good for removing toxic substances, and helping your body's own, lymphatic system and circulatory system get rid of waste. Because it's not only internal toxins that we get from, our diet, our lifestyle, our stress levels, but also external pathogenic influences, such as when you catch a cold. So when you're catching a cold in Chinese medicine, this often relates to an invasion of external influences, like wind and cold, or wind and heat, and dampness. So cupping is one way that you draw that out. Another great way is called gua sha, or scraping. This is a gua sha tool. Mostly you'll find people using a ceramic spoon. It's also called spooning. This is probably the better range of tool to use if it's available to you. They're usually a bit more expensive. This is water buffalo horn. Water buffalo horn has a very cooling element to it, and that just gets scraped along the meridians, along the skin. It's often done on the back of the neck and on the shoulder blades. You can't really see it because I've got a shirt on, but it's very good. You can see it very clearly when you do it on someone's back and neck, because that's often an area that they have a lot of stagnation in. And what that does is it also draws the blood to the surface, but it helps to release the pathogen in what's called sha, as in gua sha. And sha itself is like a form of what's regarded as wind toxin or wind evil. So it's a form of helping to prevent helping to release the pathogen that's come into the body. Because in Chinese medicine, you want to, anything that's disturbing the body or causing a problem, you want to sort of get that out before it lingers. Because over time, if it's left, and it lingers, then you can get, for example, wind and cold or dampness invading the joint. And then over time, if that, that sort of disrupts the minor circulation, and you might feel something a little bit, and then you might not feel it at all, and it sort of can sit deeper, and then later on it starts manifesting as a severe joint problem. So gua sha, as well as cupping, is one way of drawing out that external toxin to the skin. And it's great in just at the beginning of a cold and flu. You get the gua sha down the back, and it lifts up everything and gives you a bit of a buzz and can make you feel a lot better.
I'm with you.
Yeah. But as I said, like, the earlier that you get a treatment, then the better. If you're getting a treatment like cupping or gua sha just at the beginning, when you think you're getting a bit of cold, or you get a bit of tightness in the neck and shoulders, then you can prevent the manifestation, or it can prevent it from becoming too severe. Often you can dispel it completely. If it's sort of a bit more ingrained, or it's gone a bit more internally, then you need a bit more deeper therapy, and then that's when you need the acupuncture and herbal medicine as well. But commonly it's a very common tool that's used. But I'll just briefly mention in Chinese, with regards to the moxibustion, the name for acupuncture in China is Zhenju, which means needle moxa. So it shows the indivisibility of the moxibustion or heat therapy with the acupuncture needle. So it's acupuncture is most commonly used in conjunction with other therapies like moxibustion, cupping, gua sha. So it's a many faceted approach.
All right.